Hi there, this is Nursing Education Videos. Today I will be going over the hypokalemia and hyperkalemia quiz for NCLEX exam on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information and explanation is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all the credit for information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. And there might be some websites that I refer to for the definitions of some information. So, below is a quiz that will test your knowledge on the differences between hypokalemia and hyperkalemia. This fluid and electrolyte quiz will help prepare you for your lecture exams in nursing school and the NCLEX exam. It is very important you know what a normal potassium level is, the signs and symptoms of hyperkalemia and hypokalemia, the causes, and nursing interventions. This quiz will highlight the important areas you should study when preparing for your nursing exams. There are also other fluid and electrolyte quizzes on registerednursern.com. First question. A patient has a potassium level of 9.0. Which nursing intervention is priority? So a normal potassium level is between 3.5 to 5.0. 9.0 is hyperkalemia. On the website here, the normal potassium level is actually 3.5 to 5.1. So it does depend on your hospital protocols. So first, which nursing intervention is priority? A. Prepare the patient for dialysis and place the patient on a cardiac monitor. B. Administer spironolactone. C. Place patient on a potassium restrictive diet. D. Administer a laxative. So which nursing intervention is priority for a potassium level of 9.0? So 9.0 is quite high. According to this website, anything higher than 7.0 or higher is very dangerous. So in my experience, I think that you would probably prioritize in preparing the patient for dialysis and place the patient on cardiac monitor to remove as much potassium as possible. However, let's review what is on the notes here. So the nursing interventions for hyperkalemia is to monitor cardiac, respiratory, neuromuscular, renal, GI status. And then it says here, prepare patient for dialysis. Most patients are renal patients who get dialysis regular and will have high potassium. And then K-oxalate is sometimes ordered. That promotes GI sodium absorption, which causes potassium excretion. And then potassium wasting drugs like Lasix or hydrochlorothiazide is prescribed to reduce potassium levels. If we go to hypokalemia, so based on registerednursern.com, spironolactone, the other name is aldactone, is a potassium-sparing diuretic. So with a potassium level of 9.0, you would not want to administer spironolactone because it would actually retain more potassium because it's a potassium-sparing diuretic. So that would be not correct. as a priority. So I think the highest priority would be preparing the patient for dialysis and place the patient on a cardiac monitor. So 2, which of the following is not a symptom of hyperkalemia? A, positive Chauveau-Steck's sign. B, decreased blood pressure. C, muscle twitches / cramps. D, weak and slow heart rate. So the mnemonic for hyperkalemia is there is muscle weakness in hyperkalemia, so that would be crossed off, and then so decreased cardiac contractility is a weak pulse and low blood pressure, so that would be crossed off. So those three would be crossed off. So a symptom of hyperkalemia. So which of the following is not a symptom of hyperkalemia? I think it is positive Chauveau-Steck sign. Positive Chauveau-Steck sign will probably be with patients that have magnesium magnesium level changes. Question number 3. Tall peaked T waves, flat P waves, prolonged PR intervals, and widened QRS complexes can present in which of the following conditions? A, hypokalemia. B, hyperkalemia. C, hypokalemia. Or D, hyperkalemia. So if we go back to hyperkalemia, the rhythm changes are tall peaked T waves, flat P waves, and widened QRS and prolonged PR intervals, which would be D, hyperkalemia. Which patient is at risk for hyperkalemia? A, patient with parathyroid cancer. B, patient with Cushing's syndrome. C, patient with Addison's disease. D, patient with breast cancer. So the causes of hyperkalemia, the mnemonic is CARED, C-A-R-E-D, and it could be due to adrenal insufficiency with Addison's disease. So the answer would be C. So adrenal insufficiency, it could be, according to the National Health Service of the United Kingdom, Addison's disease is where the adrenal gland does not produce enough cortisol or aldosterone. So according to the National Library of Medicine, National Center for Biotechnology information, presenting signs and symptoms of Addison's disease include weakness, fatigue, anorexia, and skin pigmentation with hypotension, hyponatremia, and hyperkalemia. So, which patient is at risk for hyperkalemia? It would be patient with Addison's disease. Question number 5. A patient's potassium level is 3.0. Which foods would you encourage the patient to consume? So normal level of potassium on registerednursern.com is 3.0 to 5.1, or 3.5, sorry, 3.5 to 5.1. So 3.0 is hypokalemia. Which foods would you encourage the patient to consume? So A is cheese, collard greens and fish. B is avocados, strawberries and potatoes. C is tofu, oatmeal and peas. D is peanuts, bread and corn. So if it's 3.0 is hypokalemia, we would go to the hypokalemia notes. And the mnemonic for potassium-rich foods is potassium. So potassium has P, potatoes, pork, A for avocados, and S for strawberries. So it would be answer B. Question number 6. A patient with nasogastric sectioning is experiencing diarrhea. The patient is ordered a morning dose of Lasix 20 milligrams IV. Patient's potassium level is 3.0. What is your next nursing intervention? So potassium level of 3.0 is hypokalemia. Lasix is a diuretic, and it is not a potassium-sparing diuretic. So since it is already hypokalemic, you would probably hold the dose of Lasix. So the answers here is A, hold the dose of Lasix and notify the doctor for further orders. B, administer the Lasix and notify the doctor for further orders. Or C, turn off the nasogastric suctioning and administer a laxative. D, no intervention is needed. No intervention is needed. The potassium level is within normal range. So it is likely A, hold the dose of Lasix and notify the doctor for further orders. So we will look at hypokalemia. Nursing interventions for hypokalemia. Don't give Lasix, Demodex, or thiazides, which waste more potassium, or digoxin, because it causes digoxin toxicity if potassium level is low. Notify MD for further orders. Alright, question number 7. A patient is presenting with an orthostatic blood pressure of 80/40 when she stands up, has a thready and weak pulse of 58, and shallow respirations. In addition, the patient has been having frequent episodes of vomiting and nausea and is taking hydrochlorothiazide. Which of the following findings would explain the patient's condition? A, potassium level of 7.0. B, potassium level of 3.5. C, potassium level of 2.4. D, none of the options are correct. So we'll double check. So low blood pressure and a low pulse and shallow respirations and frequent episodes of vomiting and nausea, and is taking hydrochlorothiazide. A guess on this information would be hypokalemia. So let's hear the signs and symptoms. So the signs and symptoms of hypokalemia here is weak pulses, irregular and thready, orthostatic hypotension, as well as shallow respirations with diminished breath sounds due to the weakness of the accessory muscle movement to breathe. Hydrochlorothiazide. So this is on wikipedia.org. I went back to registerednursern.com. At the hyperkalemia and NCLEX review notes, it says here hydrochlorothiazide is a potassium wasting drug. So if the patient is already hypokalemic based on these symptoms, it could be due to the patient taking hydrochlorothiazide that is causing the patient's hypokalemic potassium levels. So which of the following findings would explain the patient's condition? A. Potassium level 7.0. B. Potassium level 3.5. C. Potassium level 2.4. It would be C. Potassium level of 2.4. Question number 8. Which patient is at a potential risk for digoxin toxicity? A patient with Cushing's syndrome taking Lasix 20 milligrams IV twice a day. B. A patient with a calcium level of 8.9. C. A patient with a potassium level of 3.8. D. A patient presenting with painful muscle spasms and positive Trousseau's sign. So D, positive Trousseau's sign and painful muscle spasms with a positive Chauvet's sign is probably hypomagnesemia. We will look at hypokalemia for potassium. So the patient is at risk for digoxin toxicity if a patient has low potassium levels. So that would be A. Maybe. Double check. Because 3.8 is still higher than 3.5. It's just a bit on the... Because someone taking Lasix 20 milligrams, they would be reducing the potassium because it is not a potassium-sparing diuretic. It's a potassium-wasting diuretic. So in hypokalemia, Cushing's syndrome, during this condition, the adrenal glands produce excessive amounts of cortisol. If cortisol levels are excessive enough, they will start to affect the action of the sodium-potassium pump, which will have properties like aldosterone and cause the body to retain sodium water but waste potassium, hence hypokalemia. So Cushing's syndrome would cause hypokalemia by wasting potassium, as well as patient taking Lasix 20 milligrams IV twice a day, which causes even more wasting of potassium, and that would be what's causing the risk for digoxin toxicity because of hypokalemia. So the answer is A. Question number 9. Which of the following is indicative of an EKG change in a case of hypokalemia? A. Widened QRS complex and prolonged PR interval. B. Prolonged ST interval and widened T wave. C. Tall T waves and depressed ST segment. Or D. ST depression and inverted T wave for hypokalemia. I'm going to take just some choices here to look at. So you review these questions, and then I'm going to review hypokalemia. So if we look at hypokalemia, the easy way to remember the 7 L's, which are this 7 lows, aside with, so 7 L's, 7 lows with hypokalemia. It would have lethal cardiac dysrhythmias, which is ST depression, shallow T wave, and projecting U wave. So it would be D, ST depression and inverted T wave for hypokalemia. The next question, it says number 9 again, but it's another question. A patient has a potassium level of 2.0. What would you expect to be ordered for this patient? Potassium level of 2.0 is hypokalemia. Normal range is 3.5 to 5.1 as per registerednursern.com. A. Potassium 30 milliequivalents IV push. B. Infusion of potassium intravenously. C. An oral supplement of potassium. Or D. Intramuscular injection of potassium. So it would be probably A or B, but it depends on your hospital policy to see if they can actually have a potassium IV push. So it says here, nursing interventions for hypokalemia, IV potassium for levels less than 2.5. Never ever give potassium via IV push or by IM or subacute routes. Give according to the bag instruction. Don't increase the rate. Has to be given slow. Patients given more than 10 to 20 milliequivalent per hour should be on cardiac monitoring and monitor for EKG changes. So it would be B, infusion of potassium intravenously. And then question number 10. A patient with a potassium level of 2.1, which is hypokalemia, has been taking Lasix daily, which is a potassium wasting diuretic. What medication will the patient most likely be switched to? Spironolactone. B. None. The patient will likely stay on Lasix. C. Hydrochlorothiazide. D. Demodex. So hydrochlorothiazide is also a potassium wasting diuretic. Spironolactone is a potassium sparing diuretic, so it's most likely A. And then I'm not exactly sure. I'll double check what Demodex is. So Demodex is also a potassium wasting diuretic. So we will input the answers. And click submit. And here we are. The results is your grade is A. Percentage of what you got right is 100. Sometimes it's very helpful to know where do we find the information so that we could practice these quizzes appropriately and correctly. So I hope by reviewing the NCLEX review quiz and the NCLEX review notes helped you better understand hypokalemia and hyperkalemia. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel as well. I hope everyone has a good day. Thanks again.